Hey guys, this is Chapter 1, Part 2 lecture of phlebotomy. We're going to move forward working through the slides. We're going to look at quality samples and quality results. One thing that I want you guys to pay attention to, whenever we're collecting labs, we discuss the pre-examination variables and the phases and the different things that can affect a patient's lab results. This plays into the quality samples equals quality results. A patient, when we send the blood work to the lab, this often leads us to our diagnosis and our treatment plan for the patient. And with that being said, it's important that we all remember that we follow the guidelines and the rules strictly when we're collecting these labs, because the patient's care depends so much on these labs. Many labs are timed. They're to be collected at a certain time depending on certain medications that they may be receiving. One of those that we'll talk about throughout this course is the peak and trough levels, and we'll get into that later. But that is a timed lab. It may be that the patient needs to have their blood work collected fasting before they eat anything. So making sure, this is what I mean by following the rules and following the guidelines. If this lab is due to be collected at 10 a.m. in the morning and we're running behind and we don't get there until 12:30 to collect this lab, then this could potentially harm the patient. The patient could receive the wrong treatment. The medication levels that they're testing for could be altered because of the time. So it's very important, that we look at that. And if we miss our timeline for whatever the reason may be, we need to communicate this to the doctor and make them aware. One other thing that we're going to talk about when we see the statement here that laboratory results constitute 70% of the objective information for healthcare providers, that is 70%. That is over half of the information that we are basing the diagnosis on. So when we see the word objective here, I want you guys to know the difference in objective and subjective. Subjective is what the patient tells you. You walk in, you're talking to the patient, you ask them if they are in pain, they tell you yes. You can't see that pain, but they can feel that pain, so they tell you verbally, yes, they're in pain. You ask the patient, what is your pain level on a scale of 0 to 10? They tell you it's a 5. That is subjective. You cannot physically lay eyes on that information. It is what they are telling you. It is what their complaints are. So just know that is subjective information. Objective information is data that you can actually collect and see. So objective would be, I walk in, the patient tells me they have a headache, and I need to check their blood pressure. I check the patient's blood pressure and determine that they have a blood pressure of 178 over 130. I can physically see that. I'm testing that blood pressure, so I know what that blood pressure is. Or if I walk into a patient's room and they are in the hospital, they come in because they got cut with a chainsaw, I can literally see that cut and that open wound. So that is objective. Objective is data that we can collect, that we can see. Subjective is basically what they tell us. So make sure when we're talking about subjective and objective data that you guys understand the difference. So here, when we talk about the blood work, lab results constitute 70% of this objective information for healthcare providers. So that's big. Making sure that we collect these labs appropriately and that we don't do anything to skew these results is very, very, very important. Moving on, we're going to talk about pre-examination phase of lab testing. We've already mentioned the pre-examination variables and the pre-examination phases just a little bit, but we're going to talk about it some more right now. Understanding these pre-examination phases and variables is super, super, super important, and it's a huge responsibility of the blood collector in managing the patient's total care, okay? So again, making sure that we collect this information and collect it appropriately and safely and accurately is very important. 56% of laboratory errors occur during this phase, during this pre-examination phase. That is huge. 56% of lab errors occur during the pre-examination phase of testing. And there's some different influencing factors that we're going to talk about, and some of these factors are very important. So we need to take these factors into consideration when we're thinking about the pre-examination phase or the pre-examination variable. Monitoring of sample ordering. Okay, making sure that we collect these samples in the correct order of draw, which we will go into in the future in further detail. Making sure that we collect, we know the patient's identification and we verify the patient identification. If we pull labs on patient A and then put on the paperwork that it was patient B and we send this all to the lab, then patient B could be treated for something that, or patient A could be treated for something that we collected from the wrong person. So making sure that we collect these lab results from the right individual is very important. Communication, safety, making sure the patient's prepared, which we will go over as we move forward. But just making sure that this patient is prepared and they're ready for that needle stick is very important, and making sure that we select the correct equipment. Okay, we also want to protect the sample integrity, making sure again that we follow the lab guidelines, that we're following the guidelines that need to take place. If there's ever a question, if you ever have a question of what's happening in the what's happening with the sample, or you feel like it may be skewed or you're not sure, you talk to your physician. We've talked a little bit about, we've hit on the regulatory agencies, but I'm going to go into that more at this time. We're going to start by talking about CLIA, C-L-I-A. This stands for the Clinical Laboratory Improvements Amendments, okay? The CLIA was administered by the Centers for Medicare and Medicaid Services and the Food and Drug Administration. When you see the term CMS refers to Centers for Medicare and Medicaid Services. It's a lab regulating agency as well, and the FDA stands for Food and Drug Administration. The FDA classifies the test as waived or non-waived with regard to skill level of the person performing the test. And then the CLIA website is going to tell you a list of tests that are waived. So we need to know the difference between a waived and a non-waived test. So over here, when we're looking at the classified test and we see that we have a waived test, that refers to that skill level of that test, okay? And then we talk about moderate complexity and high complexity. Moderate complexity and high complexity would be non-waived testing. These are separated into moderate and high complexity. So we have the non-waived testing there. I would like for you to go to your book and read that, look over the waived versus the non-waived, try to wrap your heads around that. If you have any questions, please let me know. I'm going to try to go through it the best I can in this lecture, but again, we'll be meeting to answer any of the questions that you may have about that. And so looking back at the CLIA classifications, we have the waived testing. With the waived testing, it's considered easy to perform. You just follow the manufacturer's instructions. You have little risk of error. There's no special training needed. And an example of this is going to be a urine pregnancy test. Moving forward, we have our PPMP. This is microscopy test performed by a physician, a mid-level practitioner, or a dentist. PPMP must meet the moderate complexity requirements, and an example of this is a microscopic urinalysis. All right, moving forward, we have our moderate complexity test. This requires documentation of training in a test principle, instrument calibration, periodic proficiency testing, and competency assessment and on-site inspection. You must have a high school diploma to perform a moderate complexity test, and an example of this is going to be an automated complete blood count. And then we have our high complexity, which requires sophisticated instrumentation and high degree of interpretation. Proficiency testing and on-site inspections require, and we must have a formal education to perform this test. An example of this test is going to be urine culture and sensitivity. Guys, when we talk about these different classifications, I need you to look at these graphs and I need you to break down and really understand what the difference in these are, because you're going to see this moving forward. You're going to see questions about the testing. You're going to be presented with knowing that the urine culture and sensitivity belongs to a high complexity test, whereas a CBC is a moderate complexity test. So make sure that you understand the difference in these classifications as we move forward. That's it with part 2, but if you have any questions, please let me know.